Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Okay, so now we're here with Dr. Burton Feinerman. You have heard him before. He's been working with Boomer Times and Senior Life, and he is, of course, many things, but most importantly, he's a stem cell physician and works on helping people. Well, you have another way that you explain it. What do you say about yourself?
Well, when people ask me that, it's they're expecting that I'll say I'm a cardiologist, I'm a neurosurgeon, I'm an endocrinologist, but because and then when I tell them that I specialize in stem cell and gene therapies to challenge incurable diseases, they say, "Wow, that's fantastic. I heard a lot about it, but I didn't know it was actually happening, And the important thing to get across to the American public is that stem cells are not the future. Stem cells are the present. And that for many, many diseases, we can follow FDA guidelines that allow us to use autologous mesenchymal stem cells that we extract from the patient themselves, either from their blood, bone marrow, or fat, and use that to treat their medical condition. What I have learned through the years is that these stem cells not only can repair and regenerate damaged organs and tissues, but they can actually regenerate new healthy cells of that organ. And that's the real excitement of it. Another thing that I learned through the years was that one treatment may not be enough. I was under that illusion for quite some time, but as my experience grew, I've only been in medical practice for 63 years now, and 15 of those or more have been solely in stem cells. And actually it goes even further than that because, stem cells are really not new at all. Stem cells have been widely used for the last 50 years. They've been used to treat lymphomas and cancers and especially immune deficiencies. I myself personally was involved with treating a 10-month-old baby who came into my office one day with a history of constant infections since birth, diarrhea, rashes, failure to gain weight. He looked more like a 5-month-old child than a 10-month-old child in size and weight and everything. And he was pretty sick. So sick that, just basically hydrating him and trying to get him in condition for what I proposed was going to be a bone marrow. Now, no one 50 years ago had ever treated a child with severe combined immune deficiency, the so-called bubble child, as he was more well known, and we said, well, what do we got to lose? And we used a sibling older brother who was somewhat reluctant but still agreed to do it. And we took his bone marrow and instilled it into his infant brother, and the child had to remain literally in a severe, almost like cage, with plastic, and even nothing could get into that cage except personnel who were gowned and proper with covering on their shoes and mask and hats and all that. Anyway, 3 months of that, he was able to come out of this chamber, this isolation chamber. And right now he teaches in high school. He's a teacher at a South Miami high school. So
that's amazing. That's quite a story.
Yeah, it's quite.
What made you think about that? What made you know that?
Well, I am what's called an out-of-the-box person. So I just, no matter what I encounter, even in current days, like just a few days ago, this was a couple from out of the country who had a 7-year-old child with Marfan syndrome, which is a syndrome. It's a genetic disease, and they die suddenly from a bursting aorta, an aortic aneurysm, and it's a sure thing. You have Marfan syndrome, certain death at a certain point, and all the connective tissues in the body are weak, and where the aneurysm burst usually is at the connection of the aorta entering into the heart. Fortunately, they have discovered a drug. It's called losartan, which will slow up the growth and size of that aneurysm, so that you have more time to plan. And so, I started to think, well, it's a genetic disease. Okay, the first thing we do, we target and get rid of the abnormal genetic mutation, and then we angle that towards strengthening the connective tissue in the rest of the body. So, that's a plan that's about to be undertaken in the near future. But there's a whole world of sick people that have these horrible diseases, and they go to the doctor. The diagnosis is like a death sentence at least, and yet they're told there's nothing we can do. And so it's not the doctors that contact me. Hardly ever. I can't, in 15 years, I can hardly remember a doctor contacting me about treating a patient. It's this army of patients themselves who, through the use of the internet and similar approaches, are searching. There's got to be a way to help me, And so, whether they've got end-stage kidney disease, which is so tremendously prevalent, especially in the elderly group, that, like even in my case, I've noticed that my kid, I'm going to be 88 pretty soon, and I've noticed that my BUN and creatinine have risen, that my glomerular filtration rate has dropped, and that I have albumin in my urine. So what do? Fortunately, right next door to me is a nephrologist, so he's going to save my life, right? Well, not really. He's 38 years old, and I don't know what to do to put a cannon under him and wake him up. But he says, well, we'll follow you along. We'll watch your diet. And, if things get worse, we'll put you on dialysis. Well, no, I don't want to be on dialysis. I want you to fix my kidneys. Well, there's really not much I can do, And I said, yeah, there's a lot to do. So I even told him about this book. It's called Regenerative Nephrology. And he did buy the book. And 6 months later, I see him in the hallway, and I say, well, what'd you think about that book? And you got thousands of patients. He says, well, that's the problem. I'm so busy in my office and going to handle the dialysis patients and seeing patients in the hospital. I haven't had a chance to read it. I said, I can't believe it, If you were an old cockamania like me, at 88 or so, and maybe I could accept that, But you're 38 years old. You should be out there trying to conquer the world, Still don't.
So are you going to do stem cells for yourself?
Yeah, I'm going down to Cancun, and I'm going to just treat myself.
Well, that's another question. Do you always use stem cells from your own body, or do you get them from other people?
Now, there's no reason for me to go to Cancun. Absolutely none, except for one. Like, for example, if a doctor wants to treat lung disease, COPD, emphysema, pulmonary fibrosis, you give the stem cells intravenously, and 100% of those stem cells will home in to the lungs and repair the lungs and regenerate. And so that people that you see at restaurants or places like that sitting there with their oxygen tanks, that's unnecessary. They can actually get cured with stem cells. Sometimes I see these people and I just say, gee, I'd really like to go there and say something to them. I mean, total strangers that I'm seeing. And so one day I actually did that. I went over and this woman was there with her husband, with her oxygen also. And I said, look, I hate to intrude, but my name is Dr. Burt Feinerman, and I can't help but say, gee, look at, you really can help yourself, that there are people out there that can give you stem cells and cure your lung disease. And I said, well, what is your lung disease, by the way? She said, I have pulmonary fibrosis. And I said, well, do you know who wrote the first paper over 55 years ago on pulmonary fibrosis that was published in the Proceedings of the Mayo Clinic? And she said, well, I guess it was you. I said, yeah, that's right. Yeah.
That's interesting. Yeah. So you've had an interest in these things for many years, haven't you?
Yeah. So, at any rate, you can challenge these things. Now, why am I going to Cancun? Well, I'm taking stem cells from my own body. So why do I have to go to Cancun? Well, simply because if you give it intravenously, the stem cells will not get to the kidneys. So I need an interventional radiologist who simply passes a catheter up a small vessel from my thigh and up into the right kidney and then to the left. Well, most interventional radiologists work at hospitals, so that's another big stairway to climb to. You have to get the radiologist to agree, then to go through the hospital. It just won't happen in the United States. So I found a fellow out in Boynton Beach, the only interventional radiologist practicing on his own. And I said, look, this is all within guidelines of FDA, and between my kidney and my diabetic patients, I can send you thousands. I spoke to him on the phone. I wrote him emails. I sent him a regular mail. Nothing. He won't do it.
They're afraid.
Yeah, they're just afraid. So
thank you, the medical society, right?
Yeah, well.
But it's okay. We don't have to get into that. So when you go, but let's talk about stem cells. So when you're going to replace stem cells, do you always use your own or do you use from someone? Because if you're sick, why are your stem cells going to be good?
Well, then the stem cells are there. They're there in small numbers. And so you give them an injection of something called Neupogen. It's called granulocyte colony stimulating factor. And you booster the bone marrow in creating more and more stem cells so that you can increase the number of stem cells that way prior to your giving. These stem cells also exist within the organ itself, but they're usually depleted to a great extent. And so we have to increase the numbers. The stem cells are low in these disease states, but they're healthy.
Now you're getting that from the bone marrow?
Well, you can get it from the bone marrow, the blood, or by doing a mini liposuction and getting it from the fat. in other type of conditions, like neurological conditions, we'll also use stem cells that we extract from umbilical cord blood. And umbilical cord blood is very rich in stem cells, and the stem cells are the adult form. So instead of taking mesenchymal stem cells from your own body and hoping or expecting that once they get into that the brain, they'll differentiate and become neural brain stem cells, we use umbilical cord blood as our source there, and we use it with 4 different brain nerve growth factors. So, but some of these things have to be done out of the country because they're not autologous. And so, I do have a center in Cancun and also in Lima, Peru, and I plan in the future to also have one in Freeport, the Bahamas.
Well, I'm cheering for you. I know you have really been out there, like on an island, in a sense, really pushing people. I've read your book. You are so dedicated to this, and I guess you're just, there are other people here in South Florida. You hear they are doing now. Orthopedic surgeons seem to be okay on doing some of this.
The orthopedic surgeons are the only group that have jumped into the field of stem cells in a big way. And, but you still hear about hip and knee replacements and so forth, when those patients probably could have been treated with stem cells.
So that's another thing. So a stem cell might just keep them from having to have that operation because it will grow healthy tissue and collagen and bone. Is that what you're saying?
If an orthopedic doctor is told you need a knee or a hip replacement, you should consider stem cells first, because in no way does it hinder you from still getting that surgery if the stem cells are not successful.
So the stem cells, in essence, in your body, do you know that they're there now? Let's say that you're going to go yourself for kidney. Do you feel different? When it goes in, you don't know if they're any different from your other stem cells, right? I mean, they're just there.
No, right.
But you then see recuperation in those areas that you need.
Well, suddenly the pain and the swelling, the discomfort you have in that joint disappears.
Well, people do know who've been listening to this radio show that my wonderful husband Bill passed away, but I will tell you that as soon as he was rehabilitated, which I was really working very hard on, you were on the list to help him because his vision became impaired from the stroke he had, and I definitely was going to have you take care of that because I trust you and I knew that you'd be able to do something. Mm-hmm. And so I wish that somehow people would take advantage of this. If someone's really, like you've talked about some other people who you've helped, if you're really in a bad way, I mean, Parkinson's or something that you can see the difference, why they wouldn't try to do this with you, I can't understand that, and just be miserable in a wheelchair or death. I mean, I don't understand it.
Well, I mean, just to give you the short list, I treat.
Wait, but I think we have to do is give everybody a way to contact you. Would you give me a phone number? I don't have that. Wait, I think I do.
The best number to reach me at is area code 561-557-3358.
Yes, I do have that cell phone.
That's 561-557-3358.
Yeah.
The conditions we treat quickly are ALS, Parkinson, Alzheimer's, multiple sclerosis, autism is another big one, traumatic brain damage, cerebral palsy. Then, of course, as I mentioned earlier, chronic kidney disease, polycystic kidney disease. We didn't talk this morning yet, but diabetes type 1, people that are on insulin anywhere from 3 to 6 times a day. Some of them are even on insulin pumps, which are quite tedious and difficult to live with. And then when you mention blindness, although in a different facet, the most common cause of blindness is age-related macular degeneration, which runs in the hundreds of millions in the world. than some more rare things like retinitis pigmentosa and Stargardt's disease. And when someone develops visual loss as part of a stroke, that's basically damaging either the visual cortex in the brain as well as the optic nerve. And so the thing to realize is that these things can slow up the progress of your disease. It can, in many cases, reverse certain aspects of the disease. And sometimes, I never use the word cure, but greatly return the person back to a more normal state. For example, at my office, we offer free consultations both over the telephone, by email, or in person. And so when you come in or talk, if you live far away, then we do it by email or telephone.
Dr. Feinerman, I was thinking maybe the future is just like now people go and they have facial rejuvenation, a lot of their body parts. Maybe stem cells, just fresh new stem cells coming in from either the umbilical cord or wherever, can actually make you younger, and you don't have to have a disease.
Well, you were the one that inspired me in that idea many months ago, and see, if I had like a big family medicine practice, it would, or internal medicine, but my practice is basically 100% people that already have these diseases. But if I had a practice, usually you could have something anywhere from 5,000 patients. Is not so unusual for an established man in many years. You got a whole sea of people who you can say, okay, you're 50 years old, it's time to get your heart stem cells, but my heart's fine, doctor. Well, that's the whole point. We want it to stay fine. Okay, now 51, now you get your kidney stem cells, or you're 52 and you get your pancreatic islet stem cells to prevent diabetes, et cetera, et cetera. And so, yes, in addition to other measures like checking your bioidentical hormones and your immune system and taking telomerase to repair your telomeres, stem cells could be a standard thing. After all, when you go to your annual physical, what do they really do? They listen to your heart, lungs, reflexes. They draw some blood on you and check your urine, and then give you a little pat on the back and say, "Oh, well, you're doing great." And they'll take an EKG. Come back and see me. But in terms of actual preventive care, you've really had nothing done to you there at that office visit. And the whole art of medicine, the whole science of medicine can change by incorporating that.
That's why I admire you so much, because I think you are really a pioneer in this field. So let me give the phone number again. Phone number for Dr. Burton Feinerman, Feinerman, is 561-557-3358. And he answers the phone, too. Would you believe that? 561-557-3358. And it's always a pleasure to have you on our show, the future of medicine, but with stem cells and gene therapy. We thank you for coming in. You always look glamorous. And then you have to go back to your beautiful wife.
Okay.
Thank you, everybody. I'm glad you were listening, and we'll be here next week, same time.